Hi there and welcome back. We are going to continue our conversation of the integumentary system. If you didn't see my part one video included the epidermis, dermis, and hypodermis. Now in this presentation, we're going to talk about skin color, variations, and skin cancer. So when it comes to skin color, there's going to be different variations of skin and hair color. And the reason why it has to do with a pigment called melanin. There are two main types of pigments. You have dark, which is called U. EU means true. Okay. So if you're taking your root words, so dark U melanin, and a reddish yellow, which is pheomelanin. So your eumelanin is going to have its own varieties. Sorry about the doggies. Brown and black eumelanin. That's going to be responsible for your tan skin, your brown skin, and your black toned skins. Then you have pheomelanin. The pheomelanin is responsible for the yellowish towards the reddish tones of skin. You're going to find those tones in Asians, Native Americans, and also responsible for the pinkish tones of white skin. So other contributing factors have to do with the dermal vessels and then also white collagen. And so when you get a possible accumulation of other pigments, that can actually change the color of the skin. So other pigments, for example, carotene. Carotene is a pigment that is found in yellow and orange vegetables. That can actually change the color of the skin. There are certain metals that can change the color of skin, like, for example, silver. Silver can change the color of the skin to a bluish color, and that doesn't go away. So don't take silver supplements. Don't do anything your doctor doesn't say to. How about that? Alrighty, so we have UV radiation. UV radiation, obviously, you probably know this, but it's worth saying. That is radiation that is going to come from the sun, okay? That can stimulate melanin synthesis. Yes, we do have UV radiation that you get from tanning beds and all that certain specific lights. I used to have a lizard, had to make sure that he had his UVAs and UVBs because that helped him with his metabolic process. All right, so with that, people of different color have the same amount of melanocytes, but they vary in their melanin production and how long they produce melanin, that longevity. So those with darker skin produce greater quantities of melanin, okay? And on top of that, the melanin breaks down more slowly. So those melanin granules are going to spread out into their keratinocytes, and they're going to be seen. Those melanized cells are going to be seen through the epidermis, and that is why you see that darker skin color. In lighter skin color, the melanin are going to be clumped near the keratinocyte's nucleus. And there's going to be little of that melanin that is seen beyond the stratum basale. And so that is why a person with lighter skin, because number one, they don't have a greater quantity, and it's going to actually break down quicker in lighter ones. It's not mentioned here, but it's intended. And then these are more spread out versus these are going to be more clumped. That is why you're going to see lighter skin, because you're actually not seeing the melanin in that skin. So let's go ahead and look at those variations. So you got your darker skin here. Here's your dermis. And then here's the light skin version. And then here's the dermis. So you can see here, this is the melanized cells of the stratum basale. So let's go ahead and follow that stratum basale, the single individual layer all throughout. Those are melanized cells. And then you can see here in the stratum basale, boom, it's it's actually hard to determine the stratum basale because of that decreased number and obviousness of those melanized cells. Then you have your epidermis. There's the rest of the epidermis. This is not trying to indicate the stratum basale is not part of the epidermis. So don't let that confuse you. And then you have your stratum corneum portion of the epidermis. And so as you can see here, you can see the melanin has spread throughout the epidermis versus in the lighter skin does not. Alrighty, so how did this evolve? And so due to evolutionary selection pressures, humans basically, they migrated out of Africa, okay? Humans lived in Africa, migrated out of Africa, started to radiate to other parts of the world. And then so the skin production itself is because of excess ultraviolet radiation that was in Africa. And so with that, as they radiated out, the production necessity as humans are more towards the Arctic regions, are more towards the regions that are not getting that excess ultraviolet radiation, it's not needed. So essentially, it is something that was produced that is no longer needed. And so with that, they ended up throughout lineage. This did not happen overnight. Here's the deal. I teach 11, 12. I'm trying to keep it light for you, okay? So what that means is it wasn't needed. So their offspring didn't need it, and their offspring didn't need it. And then eventually that adaptation became more advantageous in the area that they were in. And so that is basically how that adaptation eventually evolved into lighter skin. Because I'm going to throw this out there. Let's say you have one dark individual and one light individual, and you are all out in the snow in a colder area, and there are predators looking for you. Who is going to be the most conspicuous in that new area? It's going to be the darker individual. So it is more advantageous for the lighter skin to be in that lighter skinned area. Now, I just gave you a simplification of a huge process, but hopefully that helps you to kind of connect with it. All right, so let's go ahead and move on. What's some advantages of black and brown skin? All righty, so the darker skin that you have has a higher SPF, about 10 to 15 SPF, while lighter skin, white skin only has about 2.5 SPF. That is why people with white skin will actually burn quicker, because the melanocytes themselves serve as a protection against ultraviolet radiation and protect the DNA in the cells from getting damaged. And so UVR, ultraviolet radiation, can be damaging in terms of sunburn. A lot of times people might say, well, I don't get sunburned. It doesn't mean you're not getting cellular damage. So keep that in mind. Just because you might have darker skin doesn't mean you cannot get cellular damage from ultraviolet radiation, because you can. Ultraviolet radiation also leads to cancer. Degradation of folate. Folate is a B vitamin. It's very, very important B vitamin that is necessary for DNA expression. Okay, for methylation and DNA expression. You guys will go into that way later. Actually, probably anatomy, physiology too. But it can also offer benefits from stimulating vitamin D synthesis too. And so you're like, well, do I sun or do I not sun? Well, how about a little bit of sun? That way you can get your vitamin D production also. All right, so with that, your skin color is going to have responses. Okay, so skin color in response to migration is going to reflect the need for folate. So basically what I'm trying to tell you is folate is degraded by ultraviolet radiation, and vitamin D is promoted by ultraviolet radiation. So those in areas of high ultraviolet radiation might not have a problem with vitamin D production. Probably don't really, but they might have folate deficiencies, okay, and vice versa. Alrighty, so near the equator, like I was telling you, it's going to be more advantageous to have that darker skin for protection versus farther north where sunlight is weaker. It's going to be that benefit to have lighter skin. All right, friends, I feel like I've said this twice. Let's go ahead and move on. So here we go. This is going to show you the aggregation of humans that are more towards the equator and more towards the poles. And so basically, this is a very, very good representation of the lightest to the darkest in terms of where they're located on Earth. All righty, other skin colors that don't have to do with melanin production. This is probably something that you are going to come across a lot in your journey, whether your journey is nursing or whatever that looks like. So these can provide diagnostic value: cyanosis, erythema, pallor, albinism, jaundice, okay, hematoma. So cyanosis. Cyanosis is when your skin has a blueness or a bluish tinge to it. That's going to indicate oxygen deficiency of the skin. It's not getting enough oxygen. Erythema is going to have a redness to it. That indicates increased blood flow to the skin. That could have diagnostic value too. Pallor. Pallor is going to be paleness, and that paleness is due to decreased blood flow to the skin. So to be clear, this here, oxygen deficient, is not exactly the same as decreased blood flow. Okay, so as you get a little further on, you'll understand you can still have blood flow to the area, but not have enough oxygen to the area. And if I threw that out there, if you had some type of respiratory disease, that could be the case if you're not getting enough oxygen to your tissues. All righty. So albinism. Albinism is going to be when skin is white, and that has to do with a genetic component for lack of melanin production. And so it is an actual gene that doesn't let that individual produce melanin. Jaundice. Jaundice is going to be due to a buildup of bilirubin in the blood, okay? That can be caused by a compromised liver. That can be caused by an immature liver. So obviously, many of you might have heard about jaundice in newborns. A lot of that is because of an immature liver. And so, little kind of tidbit for you, living where we live at a higher elevation, newborns actually have higher incidence of jaundice than other individuals of lower elevations. Hematoma. Hematoma is basically bruising and clotting that takes place under the skin. And so it's sometimes you might have heard somebody call it a blood blister. Okay, so that's essentially what it is. All right, let's look at these two different types of abnormal skin colors. This is an example of somebody with albinism. As you can see, not only is his skin tone white, he doesn't have pigment in, I don't know if it's a girl or a boy, they don't have pigment in their hair. And so the hair, as you can learn in the next chapters, they're going to be accessories to our skin. And so there's a lack of pigment, melanin production in the hair also. Right here, what you're seeing is jaundice. And this individual here is obviously having a breakdown of their liver function. And you can also see it in the eyes, very yellowing of the eyes too. All righty, so let's talk about some markings. The skin is going to have a variety of markings. Okay, so you got friction ridge, friction lines. So let's start with friction ridges first. those are going to be markings on the fingertips that leave oily fingerprints. And so everybody is going to have that unique pattern of their fingerprints. It's going to pretty much remain unchanged throughout life. Even your identical twins have identical fingerprint. I'm sorry, not even your identical twins. They don't have identical fingerprints. So I want to tell you something really interesting. One time I cut off almost the entire tip of my finger, almost. And I looked at that tip of my thumb and I'm like, oh, I'm not going to have a fingerprint there. No. But what you learned in 1111 is that the organ knows exactly its shape, and it's going to mitotically divide and fill in all of the cells to the shape that it's going to be. So after a while, my finger grew back, had a little scar tissue a little bit, and then eventually I look at it and my fingerprint is there. I have one little tiny, barely visible scar that goes across where that knife went through it, just barely. And so that's the beauty of your organs. They know the shape that they should be. And so if there's any damage, the mitosis is going to go ahead and jump in, take over, and fill in the excess space, right? The tip of my finger space. And then when that space is filled in, mitotic division ceases. It's done. It knows the shape it's going to be. Okay. Now, depending on the depth of the actual damage and the severity of it, that's not always the case. Instead, the remodeling that can happen could be with actual scar tissue. And so I guess I just got lucky. It was in a good spot. So I just thought that was kind of a cute little, interesting little tidbit. And so what do those ridges do? What's the whole point? They're going to enhance your fingertip sensitivity. Okay. They're also going to improve your grip. All right, so the next skin marking is going to be flexion lines. Basically, they're creases. They're lines on the surfaces of the digits, the palms, wrists, and elbows. So these markings are going to be found where the skin is going to fold during flexion of those joints. And so that skin is going to be bound even deeper into, to the deeper tissues along those lines. So freckles. Freckles are basically going to be little patches of built up melanized skin, built up melanin in those keratinocytes of the skin. What a mole is going to be an elevated melanized patch, sometimes with hair also. And so whenever you have, not to be gross, a hairy mole, that's one of the things around Halloween, you get a hairy mole. Anyway, that is because of the increased production of melanin taking place. And a lot of times you also have those hair follicles that are going to be increased in those areas too. We'll go into that when we talk about our skin accessories. The thing about moles, they're normal, okay? But you should watch for changes. You should watch some changes in the color, in the diameter, the contour. So like if it used to be round, but it's starting to get these weird edges on it, this should definitely be checked because those can all suggest cancer, okay? Hemangiomas are going to be birthmarks. Okay, they are going to be patches of discolored skin. They're going to be caused by benign tumors of the actual dermal capillaries. Okay, those birthmarks, sometimes they actually disappear in childhood or maybe even later actually. And then other times they just last forever. And so, for example, the strawberry birthmark, a lot of people have seen strawberry birthmarks, port wine stains. Sometimes they disappear, sometimes they just last. Alrighty, so let's go ahead and get into some skin disorders and skin cancer. And so skin disorders, what you can expect from this little section is to learn the most 3 common forms of skin cancer. okay, and describe the three classes of burns and their priorities in treatment. In the last PowerPoint, we briefly talked about that, and I told you we were going to hear more about it. So most of your skin cancer is going to be caused by ultraviolet rays, okay? Where does that take place? Mostly on the head, the neck, and the hands. Why? Those are the ones that are the most commonly out there all the time. They're also going to be more common in the fairer skinned, and then the older you get, because why? You've been out there exposed for the most, and the fair skin is the least it's the most susceptible because it has the least melanin. So it's going to be one of the most common easily treated cancers, as long as it's not one of the really difficult ones that have actually gone deeper. We'll talk about that. So your skin cancer is going to have highest survival rates if detected and treated early. And by the way, this right here, detected and treated early, is going to be the key for this, the easily treated, okay? 3 different types of skin cancers are going to be named for the epidermal cells in which they originate, okay? Basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. So the basal cell carcinoma, the most common one, it's the least dangerous. It very seldom is going to metastasize. Metastasis is when it leaves its origin and then those cancer cells go to another place on the body, usually accessed from the blood cells, the cardiovascular system or the lymphatic system. Those cells can break off and then go somewhere else in the body and then set up cancerous tumors there. And so because this is less likely to do that, it is the least dangerous, okay? It's going to form cells in that stratum basale. That's why they call it basal cell carcinoma. It looks small, shiny, central depressions, beaded edges. So whenever this is your central depression, it looks a little bit like a volcano if you think about it, little beaded edges. And so you can see compared to the rest of the skin, it has this sheen to it. And so that is a very common one. Squamous cell carcinoma. So your squamous cell carcinoma is going to take place in the keratinocytes of the stratum spinosum. Okay, those lesions are usually going to be found the scalp, the ears, the lower lip, the back of the head. These are going to be the places that are the most prevalent to be in the sun very often. They're usually going to be raised, reddened, more scaly. If you recall in the last one, it was really shiny. This is more of a scaliness to it. It's going to later form a concave type of ulcer. The chance of recovery is going to be good as long as it's detected early and removed. Although if it's not detected early and removed, it is going to it's going to metastasize into the lymph nodes. And if it gets access to the lymph nodes are access to the rest of the body. And so that's when it can become lethal. Melanomas. So your melanomas are going to arise from your melanocytes. So it's in the name, okay? This is going to take place. The melanomas are going to be less than 5% of your skin cancers. They can be successfully removed if they're caught early and they don't get access to deeper layers of the skin. It's usually fatal if it metastasizes. So if it is not caught early and it gets access into deeper tissues, it could be fatal. And so it's going to be the greatest risk if if you have a family history of those melanomas. You're going to have higher incidence in men, redheads, and people who have had lots of severe sunburns as children. So the big take home is the severe sunburns you got as a child could be the melanoma that you get as an older adult. All right, so your burns, the regular type of burns, not the sunburns. So they can result in death due to fluid loss. So I talked in the last chapter about the possibility of water loss, also infection and toxins that enter into the burned dead tissue. And so if they're going to be classified according to the depth of that tissue involvement. Your first degree burns only involve the epidermis, okay? Your second degree burns are going to involve the epidermis and parts of the dermis. Third degree burns are going to be involved all of the epidermis and the dermis and even deeper tissues beneath the dermis, the hypodermis. And so with your first degree burns, what they look like, they're going to be red, they're going to be slightly swollen with edema, they're going to be painful. They usually heal within a couple of days, okay? Second degree burns, the ones that have involvement into the dermis, that partial thickness burn, they're going to appear red, sometimes tan or white, okay? Those are the ones that blister and are extremely painful. About 2 weeks to several months it might take to heal. And these are the ones that might actually leave scars. Those third degree burns that involve all of the dermis, all of the epidermis, and deeper tissues, those are the ones that are usually going to require the skin grafts. They're going to need to be closely monitored to make sure that there's constant fluid replacement, infection control, because now we have lost the ability to keep microbes out, to keep antigens out, and additional supplemental nutrition to help with the building of the skin back up. So as you can see here, here's your first degree burn. Gave ourselves a sunburn because yes, you can get first degree burns from the sun. So it's not always just from fire, from water, you can get first degree sunburns too. And it's showing you here that it is taking place in that epidermis. It's just calling it a partial thickness burn. And then here, going into the dermis, these are the ones that are going to cause those boils and bubbling. And then the full thickness degree burns, all of the epidermis, all of the dermis, and into the hypodermis. This is the most dangerous burn. And so, like I was telling you, you have your UVAs, your UVBs. We shouldn't call them tanning rays, okay? Improperly called tanning rays and burning rays. Both are thought to initiate skin cancer. And, you know, as much as say, I have a nice healthy tan, there's no such thing as a nice healthy tan. You are getting skin damage, no matter what your level of healthy tan is. And so you should be using sunscreen to help to protect you from the burns, okay? But it doesn't necessarily mean you're completely protected against skin cancer. So with that, you know, just keep in mind to protect yourself on when you go outside. You don't want to be outside at the highest degree of that UVA and UVB during the day. And so your high SPF numbers, they actually do not protect you as much as you think they do, okay? Give that false sense of security. On top of that, you have chemicals in your sunscreen. Some of those chemicals can damage DNA also and generate harmful free radicals, which is not doing you any good in terms of trying to stay away from cancers. And so it's really important to monitor your time in the sun. And not just sun, let's be specific, sunbeds, sunlights, all of that stuff. Anything that has your UVA and your UVB rays. All righty, I hope you enjoyed.